Hey, Mr. Finsky, how are you?
I've been better.
Do you have any pain right now?
Yes, it's a 6.
Where's your pain at? What's it feel like?
It's just like my lungs and arms are sore.
Okay. Let's see if we can do something for you. I'm going to perform a little assessment on you real quick. Can you tell me your name and date of birth?
Yes, Bob Vinsky, February 1st, 1966.
Okay, I'll take your blood pressure. And can you tell me where you're at right now?
I'm in the hospital.
And do you know what year it is?
2022, I believe.
Okay. Taking patient's temperature, it's 98.2. Blood pressure taken, 146/90. Now I'm just gonna feel your heart rate real quick. Heart rate 112, both 2+, equal bilateral. Now I'm gonna listen to your heart. Patient noted with a productive cough. Heart sounds regular rate and rhythm, a little bit diminished. I'll go ahead and listen to the lungs. Noted fast breathing, regular respiration rate 30. Listening to all points of the lungs. Okay, can you sit up for me and I can listen to the back side? Okie dokie, you can lay back down. Putting on pulse ox is 88%, and then patient is noted to have nasal cannula 2 liters oxygen. Okay. Now if you can look into you can look at me and I'll look at your eyes. And then can you look at my light, or my pen, and then follow it out? Awesome. Pupils equal, round, reactive to light. Accommodation is good. And I'm gonna check your pulses and your feet. Pulses are 2+, both bilateral. And can you push down on my feet for me? And then pull up. Awesome. And can you squeeze my fingers? Squeeze my fingers.
Sorry, I get a bit confused.
That's okay. Okay, and have you had any burning or any problems when you urinate?
No.
Okay, and then any problems when you poop?
No.
When was your last bowel movement?
A few days ago. I've been a little backed up, I guess.
Okay. I'm gonna listen to your bowel sounds real quick. Okay. Bowel sounds active in all quadrants. And then I'm gonna check your cap refill. Just look at your fingers. Less than 3 seconds. Less than 3 seconds. Okay. Do you have any questions for me?
I don't think so.
Okay.
Everything seems fine.
And I can check the skin. Notice any wounds or anything. No wounds to the patient. Patient has no IV, no drips going. Wound, I could check the underside also and see if there's any wounds or anything. And noted upon auscultation to the lungs, there was wheezing on expiration, and the expiration was prolonged. Okey-doke.
All right, Clara, who's my patient for today?
Okay, you have Mr. Finsky in room 2. He's a 57-year-old male, full code, no known allergies, and there's no precautions. He came in for acute respiratory distress, and this is his first visit because he has chronic COPD, so this is his first exacerbation of the COPD. He was admitted yesterday, 3/28, into the ER, and he came from his home. He has a social history of previous smoking, and he was a carpenter, but he no longer does either of those, stated by the patient. And then he has emphysema, chronic. He's AAO times 3. He's confused to time, but orientation is getting better throughout my shift. He's not on telly. His last bowel movement was yesterday, 3/28. He voids and gets up to go to the bathroom. He was pale and cool, but now it's improving as his respiratory status is improving. He gets up, no issues, but he does complain of shortness of breath. He has a Venturi mask going now. It was nasal cannula, but now there's a Venturi mask going at 28%. It was 40%, but since the status improved, he's now at 28%. Vitals are stable. They're trending, his respiratory status is trending upwards, so his rate has gone down. He's a little less anxious. Minimal complaints of pain now, and it was originally from his shortness of breath and chest tightness from breathing, but as of now, he's okay. He has high RBCs in his labs, but that's compensatory with his condition. He has inhaler treatments of albuterol, Atrovent, and prednisone. They were going with a nebulizer, but now doctor prescribed inhaler. He has chest PT 4 times daily. Not a fall risk or a skin risk. He's not a chem stick. And he's having so my recommendation, he's having some trouble mobilizing his secretions, getting a productive cough. So I would just teach him the huff coughing, and continue the chest physiotherapy, and then monitor for any worsening signs and symptoms of hypoxia. And then if O2 continues to improve, then you can take him off oxygen. Any questions?
No.